Greetings to the viewers of this video. In this video, we are going to see what is nasal douching and the procedure for douching. Nasal douching is also called as nasal irrigation or nasal lavage. Rinses the nasal cavity with a saline solution. The saline solution can be either balanced isotonic solution or stronger hypertonic solution, but it is not medicated. It is performed to wash the nasal cavity for removing the mucus and the debris from the nose and sinuses, and it enhances the nasal breathing. The Indian Ayurveda medicine recommends using this technique as a part of personal hygiene in the name of Jala neti, which means cleansing nose with water. It is an effective therapy to relieve symptoms of sinusitis caused by upper respiratory tract infections such as common cold. In addition, provides symptomatic relief from allergic rhinitis. In a research conducted, it was shown that nasal irrigation could help to reduce the viral load of COVID-19 virus. Flushing the nasal cavity can soothe the inflamed tissue and remove irritants such as allergens. Let me explain how to prepare solution for nasal irrigation. First of all, take a vessel of 1 liter capacity. Along with the vessel, take a bowl for holding up the salts. And now comes the hero of this procedure, bulb syringe. This bulb syringe is used to clean the nasal cavity. Measure and boil 1 liter of water in a vessel to remove harmful elements from tap water. Once cooled, transfer it into another container. After this, measure and take out 2 teaspoons of iodine-free salt, salt in which iodine is not added artificially. Iodine-free salt is preferred because iodine-containing salt can irritate the nasal mucosa. And along with the salt, take 1 teaspoon of sodium bicarbonate, baking soda. The salt and the bicarbonate together create a balanced isotonic solution. Now, carefully transfer the contents of the bowl, which contains salt and soda, into previously boiled and cooled water. Mix it up well, with the help of a spoon, and let it get dissolved fully. Ensure that there are no visible residual crystals. Do not use the saline solution in too hot or too cold conditions, as it may affect the nasal cavity and sinuses. Do not store the solution in fridge or heat in microwave. Use it within 24 hours of preparation. Ensure that the dry ingredients have dissolved before proceeding and the solution is in room temperature. And remember that you should mix the salt with boiled water that has cooled down. Now, the time to use the nasal syringe. Ensure that the nasal syringe is clean and free from contamination. Now, go to the washroom and lean over the sink. Squeeze the nasal syringe gently, let the air go out, and now, slowly drench the nasal syringe inside the saline solution, and allow it to absorb the solution from the vessel. Once the solution is absorbed, take the syringe out, grab it in your palm, bring one of your nostril near the syringe, and squeeze it out forcefully, with the help of your hand. By doing so, the water squeezed in one nostril should come out of the other nostril. Do not swallow the fluid while washing the nose. In addition, while douching, breath through your mouth, as you cannot breathe through nose. Use 250 milliliters for each wash. Some of the adverse effects are nasal irritation, nosebleeds and headache, which are tolerable. However, be cautious. There is a very high risk of infection if the water used for douching is tap water or not boiled one. You may get some amoebic infections through unsterile water, which may be fatal. Thanks for watching. Have a great day.